Alright, so welcome back. So what I'm doing now is I'm doing little quick gestures of out of my head of leg positions based on knowledge, just gestures with no model. Okay, and I'm thinking about now what I want to do for a longer term diagram. This is something now that you can do in your studies once you start to acquire knowledge and you have a good handle on the kind of the basic diagramming that artists do of the front, side, and back view. Then you can start to get a little bit more complex with, okay, what kind of position would I want to do? Like for instance, I might do, this is part of the thigh to a knee here. Like we've kind of seen this before with the last one's leg maybe kicked way up here, with the lower leg calf coming through over to the medial malleolus or the ankle, and then of course the foot might come out of here, beginning like so, something like kind of like that, and just get an idea, and then whatever you like, put it to the side as reference, and then use it as your active diagram. So gather your drawing diagrams. If you have an écorché or bones like I do off to the side, I've got the pelvis, I've got my bones here, and then I've got the écorché. It's right off camera, just right there. You can't quite see it. Let's see if I can pull out a little further so you can see kind of what I've got. It's right off camera there, just right off the drawing table here, big drawing table that I have. So that's how I begin to look at diagramming. So once you do that, I'm going to choose a diagram. I'm going to choose this one. This one has a lot of distinct, interesting, I think, possibilities. So I'm going to use it now and work with it, and then we'll diagram it out and make our muscles work for us. So I'm going to put it over to the side just out of camera, and we're going to do this leg active diagramming with you. I'll do demonstration here. So I'll put it out of the way, but I can still see the reference of it. Out of camera, yeah, just out of camera there, just to see it just enough so I can get an idea. So the trick here is to not work from reference, it's to work from your imagination and try to put all of these forms together. You'll get ample opportunity to work from, should be hopefully live or reference material, but you also want to be able to work from imagination. Quite frankly, that's what part of all this is about. I'm gathering my pencils now, is to be able to put your imagination to work for you in addition to working from just observation. And then later on you can decide what it is that you want to focus more on exclusively, or you can have a more well-rounded idea of what's going on. Okay, so I'm going to start with our diagram now, active diagram. So it's mostly about the lower leg, so I'm going to pull out I think what I'll do is let's pop up the gesture drawing here that I did, so we can kind of use that as our guide. So now we're drawing from our guide. So I'm going to work with up to the knee here, the patellar region. I might make it a little bit more, slightly more 3/4 later. We'll see how that goes. So I'm coming down with my gesture over here. Pelvis would be in through here. Going to feel the box. I may turn it just a little bit like so, feeling that box in through here. It's kind of a volumetric drawing now after the gesture, isn't it? Just to feel all that together a little bit. Thigh back in through here. We'll cut this now. We know that would be an adductor on the medial side coming through, keeping it light. We know that would be biceps femoris iliotibial tract area. We'll just cut into that a little bit. Keep this going and around and over and through. Maybe the trochanter will pop out there later, not sure yet. We have that. Okay, so we're coming down. Make sure we're completely in camera. I'm going to pull out just a little bit further. There we go. Bring this down a little bit. There we go. So you can see that. Get all that locked in. Okay, now we can see the whole thing. So now what we see here would be starting of the ankle the malleolus, so we know we're on the lateral side, roughly in through here, so we know that the fibula would be over in through here, coming over, so we would be low on the outside, high on the inside, so the malleolus on the other side would be roughly in through here's a box, and we would see the foot kind of have a pointed kind of ballerina maybe pose, dancer pose maybe going in through here, so we'd see this foot come over, bone come over here like so, and around, and this would tuck, the heel now would tuck probably in through here and over, back and underneath, something relatively like so. All right, so we have a volumetric gesture now. Now we can slow it down a little bit and start to put on these forms further from our studies here. Okay, so now we can come back over here. We can kind of think about maybe the pelvis region. I'm going to draw a little bit of it. I'm going to draw a little bit of bone here. I may go into some muscle, but we want to focus more on the anatomy through here. So we're kind of thinking of this pelvis now in this position, right? We're kind of pushing it through here. So I've got the trochanter area, the acetabulum, roughly right in through here, a little bit more downward trending, slightly to the side. So we'd see that ball joint of the femur here, the trochanter now coming out and downward. So the actual ball joint after the neck would probably, we wouldn't see much of the neck, maybe going in a little bit here. Then we'd get this move up, right? So we'd curl up, that bone is curled, coming up through like so, okay? We'd see that, okay? Coming over, and then we're gonna get that wonderful kind of knuckling of the bone. So we're gonna straighten that out at the knee, in through here. We're gonna come down with that femur, okay, like so and like so, in through here, roughly. Okay, we know that it's going to be clubbed as it comes around, right, to get that knuckle. So we're going to feel that club part of that. In through there, we keep the drawing line. And you kind of, this is technique with these Carbothello pencils, these pastel pencils. You can kind of smudge things out, or you can draw bluntly and then wipe it away with your hand. When I was a student at Art Center, Bern Hogarth used to do this, Glenn Villepeu, Steve Houston, those folks would do this, and it worked out well for big studies like this. I like to do these big old physical kinds of studies. So the knuckle now will be here, just a technical point of view there. Knuckle in through here, coming around. We know about this now, coming down and over. We see that. This will be pulling back in through. I can blur that out just a little bit, and through here and over. This will head out over a little bit, top out here a little. We see that coming over. Remember, we're on the lateral edge of that. Bone in through and down and over, maybe a little bit lower with the greater trochanter in through here. So that's feeling nice. Putting in through here. Let's go ahead and put on the lower bone, shall we? So we're going to get that tibia. Remember that tibia, that tear, that T kind of shape in front, or V shape, and so that's going to come down like so to the tubercle now of the tibia, right in through here, and then it'll get even pushed down now, right, even further, and we're going to get those wonderful little tubercle kinds of heads to get a little bit more to the side and through here. I'll smudge it down a little bit so we can see through that later, right in through here, and then this is going to turn and soften. Right, and we get that big clubbed turning kind of head in through here. And remember, the ends is kind of a prism, so we're going to come in and we're going to curl around a little bit now to the side in through here like so. So we're really learning as we're drawing bone through there, aren't we, too, as well. So we get that feeling coming through. Now the patella, let's actually get the bone coming on down. So remember, we've got that wonderful S curve. Remember, it's on the medial end, so we come here, right, and then over, right, and then down, back through, okay? So we're going to get that malleolus here, the medial malleolus, up in through here and over, box it out, over and through here, coming down and through. We're going to get that part of it. through the edge, through here, back up and through here, and coming over, okay? So we've got that a little bit. We'll go a little bit thicker now with our bone. This is all going to get shaved, kind of downward and trending in through here, about to there. Always move your gesture if you need to, for sure. Back on up and over, like so. So there's our generalized tibia. Now the fibia will nestle into that side back area. Remember that? So we've got that head. Now we're more to the side now, a little bit, as we're kind of twisting and pulling. I'm starting to get a feeling for it. So we've got that fibia head in through here, and it's a little bulkier down at the bottom, but we're on a side, kind of a side lateral feeling. So I'm thinking about a box and then kind of an oval, kind of ovoid kind of shape too as well through here. So we've got our tubercles. And through here, that tendon will start to come up. And the ligament, really ligament first, and the tendon through here. And up and over, and that patella will start to head out this way, further over this way, kind of that shieldy pear shape over now. So we're in a slight 3/4 now. I had it profile earlier, and I've changed it a little bit to 3/4, which is really a better view. Try to get all the active diagrams a little bit more 3/4-ish, because we can start to see a little bit more of the dynamics of the form. So we get this clubbing. This is going to move actually now this way. So it's more like a cylinder in this view. Let me make sure that's clear. Here, box here. So as you follow these and you draw from these, which I highly want you to, all students, both YouTubers and my students, it's important, not for ego things for sure, but to learn from, and then go and draw your own, make your own, and then draw from master study. So we have the fibula now. Okay, we have the fibula now. We're on the lateral side. Really, the medial side is over here. We have to be careful. I used to do that earlier. Now we know that the malleolus now is lower, so we're here. So I'm going to kind of mark it where we're going to. Then we're going to come up, give it a little bit more separation, like we've talked about. Here it'd probably be even closer in terms of perspective, but we're gonna forego that just a little bit and show that distance. So this will get shaved downward towards this end coming through. Catch up here, then the back end of it here, and over to the malleolus of the lateral edge, right in through and downward. Kind of a teardrop shape as well. Here can be the side of that, right in through there. So we've got our nice bone situation going, and then we can get the talus over here of that word really reminds me of a bird, eagle, talus, and through here the calcaneus bone would be coming from back here, and a downward kind of aspect over and around. We haven't really talked about it yet. So what we're drawing then, we're supposed to be drawing out of our head, right? But we're really kind of drawing this area kind of in this position, and of course the foot is flexed, so the extended, so the extensors are pretty extended, but we're drawing this little bone here and the talus up and through here, making this the hinge joint of the two malleolus bones in through here, and we've got our nice angle going high on the inside and lower now on the outside and through here. So we've got this going in through here, and this roughly becomes a triangular wedge, moving like this downward. I'll show you that more later on as we go further with it, and we'll just get the sense of the bone, the tarsals and the metatarsals out through here and over in this kind of shape, and through it around and over, kind of down. Now I'm referring to my drawing to see what I did over here. Like that, and so I've changed a little bit, but I've also kept mostly the spirit of it, and that's important too. And this, of course, the phalanges will start out and through there, and I've kind of run out of room mercifully. Okay, so we have that coming through. This will be the side of that, so we can kind of push that now to the side. So now we can come up here and gather. I think we've got most of our bones. I think I'll get a little bit more now of the area around the pelvis, just to have that, because we're a little bit tilted now slightly, just slightly forward. So we're coming, let me get a little bit clearer now. The acetabular coming in through here, get a little bit of the pubic notch arching through here, then coming up so we can start to feel all this together. Pelvis now coming over through here and over, back down. Okay, and I've got a good sense of it now through here, back down to the foramen area and the ischium here in the back, and we can start to feel where the buttock would be placed in through here, and we get a little bit of the wing back in there and over. So there's our pelvis. I'm going to keep that pretty general. And you can start to keep your bones more generalized, certainly, as you focus more on muscles, and then we'll just pull the abdomen, get a nice design line going back in through here, back in through here. It sounds like somebody's emailing me. Get my email, my big desk around here, and they've got probably the glute now coming over through here and wrapping around. So all this is getting now wrapped around, right? Coming off this iliac crest, okay? So we have this kind of feeling here, this kind of feeling wrapping off the trochanter though, right in through here, and then underneath to, remember, right in underneath the linea aspera, it'll come in and start to attach up around there tighter, and a little bit of outward to the ponderosis through here. So let's get just the overall general upper leg form going through here. And so we know that this is the medial side, right? This will come out so we can feel this downward. Well, first thing we'll feel, right, is that nice tube of the leg. So here we get the 3-finger gap, roughly right in through, actually up a little bit, be higher now, I can feel it up and through there, of that sartorius area, tensor fascia lata coming off now, the crest up at the top superior crest, and rectus femoris right in through here, coming downward, the tensor, in through here, roughly around, sheathing on that trochanter, okay, right, through there, iliotibial tract coming over, and of course that'll be the middle area, and through there a little bit, so tensor fascia latae, the Starbucks muscle, remember that. If you don't like that expression, come up with something better. I want to hear something better. My students hear that, they kind of roll their eyes, like, okay, this is kind of the Starbucks muscle. That's the way I see it. All right, so maybe a little bit lower with the bone up and through here. Now coming up underneath all of that would be the biceps femoris, okay, emerging out from underneath there, but attached over into the ischium, right, which would be down under here, okay, the ischium is under here, coming through here, tendinous, bulging out in this particular view, coming over as its head, and then start getting into that nice long tendon here, okay, and it's going to attach now, remember, the back of the fibia. So when you have it, when you know where it's at, it's easy to start attaching it to that, right in through there. And this will be very pronounced in that view, right in through there, that tendon, right into there of the biceps femoris, and then we'll get a little bit of gap in through here. Okay, we'll get that in through, right? Get a little bit of that, okay? A little bit of gapping through there. And then we'll have the iliotibial tract, and that's going to come down and sheath over here. So we get that other tendon, the iliotibial tract, and it's going to come up now and over like so. And so we might get this, okay, through here, over. But now the vastus lateralis is going to come through, and remember that's going to attach to a little bit of the lateral head over through here. So I guess we're going to do a thigh study, it looks like, and also a lower leg study too as well. We're going to do both, looks like. So let's get that vastus lateralis in through here, coming up and over, attaching underneath to the lateral part of the under trochanter, coming up and over, okay, like so, roughly. Get a feel for it, It would bulge in through here. Now we're going to have the rectus femoris come up on top. So lateralis in through here, lateralis in through here, bulging, bulging, coming down, and the bulk of the muscle will end about right in through here, because the femoris is shorter, the medialis will be longer. The medialis will be somewhere roughly right up in through there to get that side medial look of medial look, not medial look. Sorry about that. And then the tendon now of the vastus lateralis will come over and start to attach now to the patellar region and sheath over it and get down to that ligament here now. Let's see, there's the pencil I want. Get over here, okay, and that's going to create some area. Now remember, we have meniscus and we have bursa down in through here, areas in through here, and more ligaments and some more tendon area, but that's what it is mostly in through there. So we get that coming around and over, okay. So we get that coming through, and then we're going to get now the rectus femoris. So we get this little feeling now of the iliotibial tract coming through. A lot of times you just won't see it. It comes up in through and up through here. And of course we have the tensor, right? Sartorius would come here and then disappear over. Like so. Rectus femoris, now it's going to attach, remember, up to the inferior crest. This is the superior, the higher one. It's attaching underneath to this one, coming over. So that rectus femoris now is going to give us a nice, it's right up under through here, attaching up and under. So it's going to give us a nice straight in through here where the tendon is mostly, and then it's going to give us this bulk, roughly, this design line. Roughly in through here, coming through and over, okay, and it's going to get end earlier, roughly right in through here, and then get a little bit flatter as it comes over with the tendon here, and then the tendon off here, okay, this is like the side part of the tendon, and then down to the, down on the patella, okay, so here, down, and then onto the ligament. And then there we go, there we're attached right up and through. That's important to see there, coming through that. And so this view of it will be a little bit blocky as it starts to disappear into any fat or material that we have. So it gets a little bit of this view here, and then it gets a side plane view. So we'll get this here, okay, of this muscle. So it's rounded, but it's also a little blocky too. They're all that way. So they have the best of both of that. Then it might get lost in through here, and then we're going to pick up here and get more of it underneath here. Let me get this cleared, figure out where exactly I want to feel that coming up and through, and then over, up, in through that area. The lateralis can come up now a little bit further and go underneath there. So let's get cleaner here. There we go. Rectus femoris. There we go. So we can start to bring that along, and sartorius a little bit up and through there. And then the head of the rectus femoris, nice and through there around and down, and that's where perspective comes into play. Then we have this turning underneath, and of course this wants to turn way over, like so. And then we have the medialis over here, feeling this over, and then coming right over to us with the tendon. So we'd feel this ending here, and then if the tendon top right in through. So his could be like the side of it. You'd feel that right in through here and over, coming over to that knee, rectus femoris here. So let's feel that in vastus lateralis tendon. You start to feel that in through there. So we have good stuff happening now all over. So let's clear it up a little bit. Iliotibial tract in through here, right? And then the biceps femoris in through here. And then the glute, so it comes over, this glute, I'm going to bring this glute down a little bit further up and through, and then of course it's going to go back to the bone, the linea aspera. Okay, it's going to come back up and go all the way underneath that raw line, which sounds pretty funny, raw line. Rawhide, raw line. Those of you that are American, you might know the old Western cowboy and Indian show Rawhide. Raw line. Da, 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 da. Okay. Neither here nor there. Attaching over. Okay. Through here. Get a nice finished sort of design here with the oblique into the pelvis, the oblique in through. Right. Coming over. Through here. And then of course the biceps femoris now underneath. You can start to really feel that coming. Like that. And through, we've got some good things going now, I think, with our leg muscle. And now let's take on the major challenge over here of our forms. And so, you know, we've got all these names. Remember our 6 lower leg muscles, the Fibialis Longis, Fibialis Brevis. Okay, we have the extensor digitorum longus. We have the tibialis anterior, the gastrocnemius, and then the soleus. So what we'll do now is let's get the outside shape of the leg. I think that's important. So I've got the box here, and it's changed a little bit. We're going to feel that. It's an interesting place for the calf because we've got this nice box, okay, here across here, and we feel this box, and here relatively, I'll mark it a little bit. Here's where the side plane of the box, right about the iliotibial tract area, patella, right in through here. I'll mark that with some arrows. It's good to draw arrows. Get in the habit of drawing arrows to help you with direction. And so the box is doing this. It's also, all of this is coming over here, underneath, over, underneath, tendon, right? Okay, tendon in through here. Okay, biceps femoris tendon, over, underneath. All that good stuff is coming in through here, and then we're down in under, around, and we're coming back like a cylinder. Okay, it's important to see. I know it gets a little lost. Find it through here. Okay, here we go. Give yourself that to help. Now, let's put on the overall feeling of, we see the box here. Okay, let me finish that idea. Hello. Right into here. So there's the box coming down. Here's the side. I want to draw all of it because you want to hold it in your mind, but that's what I'm thinking as we turn that corner, right? So this is starting, the thigh is going one way, but then the knee, kind of, I have it now in a position where it wants to turn a little bit, and that's important to see too as well. So we'll sit this person down a little bit right in through here on something, a little bit of a cloth or whatever, where they're sitting down on. They've got that. So the overall feeling, now I'm referencing my sketch again, and we're going to feel maybe this calf and soleus area in contracted. Since they're extending here, they're going to have to contract back in here to get that feeling. So we have that. And then I know that right in through here, the longus and the extensor digitorum longus are also going to be in kind of a Rubens sort of contracting mode. And they're going to come down in through here, right? And all this is going to come down and attach, okay? And these are the longest muscles, actually. So they would come in down here and go underneath, right? One with the brevis, right, would go under, okay? And it would come back over, and we're going to go to the fifth, so it would come up and over, right, and go to the fifth, which would be right about through here. So we want to make this more lateral looking now. Put on the pad in through here and over. I want to make sure that foot's correct. Right in through here. There we go. That's correct, more correct. With that fifth metatarsal now is going to be roughly pinky phalange would be big. So I've got that foot in the wrong position. So it's good for me to change it. So see where this is good. This is a good learning experience where I make a mistake. It's good for you to see that, how hard this can be. Is that I had a medial view of the foot when it should be lateral. So now I've got to change it. So a good student in class will be able to tell me that. Obviously, if you're in YouTube, now you won't be if you're watching the video. So that's good. It's good to see how hard that is. So it is tough to keep it in position a long time if you're waiting for a long time to finish it out. But no excuse. So I loved. It's actually really good to show you my mistake, so you know that it's okay to make mistakes. And look how I just changed it. I just changed it. Boom. Here's where the fifth is going to be. Right in through here. This will come down. This will come over as a metatarsal bone. Here's the knuckle of it, the condyle. Right in through there, and we'll go on to the small toe here. Right in through here is about halfway, okay, in perspective of the foot, right in through here. So we're going to know later on that brevis is going to come, and it's going to come right up on that fifth, just like over here, and wrap around and come over and behind it and come underneath through here, and we'll get clear in a moment as we come up underneath. So we feel that it feels pretty good around there now as we come up with the anatomy. All right, so we have this look. I like what's going on with this look. The soleus and the gastrocnemius will come underneath that. So that means that the extensor and the longus, so I'm going to call the extensor, and the longus the Fibialis longus for now, right? And it will be in that position. Okay. Now coming over to this side, we have a different issue because we have the medialis over here. Then we would have the sartorius on this side. We probably wouldn't see much. Maybe it would bulge out a little. I'll give it a little bit of bulge in the gracilis over here. Okay. Then we get the rest of the patella right in through there. Let me make it a little cleaner so you can see that in through there. Part of my pencil's broken, but it's still hanging on by a thread, so sometimes you can use it. There we go. That position. That's it. Okay, so we see that. Now we're going to come down. We're going to feel this as just bone material. Over on the other side, remember, we're going to feel a little bit now of the soleus coming through a little bit over through here, right? So we're going to feel that over through here. We got to have that feeling over. So we're going to get just a little bit of this bony kind of shin feeling and this calf feeling as we're turning. It's kind of turning towards us. But we know that the medial is longer, don't we? So we know that it's going to stay longer probably to there. So watch this. This egg form that we draw right in through there is important. Then this is going to stay straight now, the bottom of the soleus coming through. Here's the bone, right in through here, back on over to, right in through here to the malleolus, which would disappear now in that space and stay about right there. Okay, so that's the shape we're going for, right in through there. And now let's take a moment, take a deep breath, and let's put on and find these muscles and really get it cleaned up in through here a little bit. So we'll just get some contouring so we can start to feel what that's going to be around this muscle as it comes back and over that way. All right, so let's tackle now the calf here. Let's take on these front muscles in through here. Okay, this is where a real difficulty is, remembering and then separating out. So the first muscle I'm going to put in is the tibialis anterior. So we know it's on the tibia, right? And we know it's attached up high to the muscle form. What we're going to see now is, remember, it's inside sheathing now on our spinal area in through here of the tibia. So right in through here, it's going to start to bulge out further and give us this view. Remember, it's going to come down more in front here and roughly end here. Give us a little bulk in through here, okay? So it's going to do that. So we're going to feel that interior forming through here. It's a pretty large muscle. Then remember, the tendon is going to come down, okay? And it's going to go over across to that first metatarsal base. Now underneath, right, the foot to, and let me pull out, maybe we'd see a little bit of the big toe digit in through there, the flange. It's going to come across now and go underneath and disappear and go to that base of that foot. So we have that. Okay. Now let's come on up through here. Let's find it now. So it's going to ride up in through here. So the tibialis anterior coming up in through, up through here. Okay. We'll start to color it in as we go so you can get a feel for it. In through here. Right? In through and up and over and attach right up in through. Right up in through here. Tibialis now interior. Okay, pretty strong muscle now in the front. All right, so we have that. And if you can't find it, I've got my Eckerget over here. We're looking, getting some help. Get yourself help a little bit. Look at your own diagram so you can put it in the right space up in through here. It's going to get a little bit narrower. So there we are right there. So now what I'm going to do is take a different color and give it a little bit now of separation so we can see it. Tibialis, interior muscle, and just keep repeating them over and over, and these can yield to your study. This could bulge in through here. Then it gets flatter to this top side here, more medial side. Okay, so a little bit wider in through here. Then it's going to emerge down and over and attach right in through this area, pretty high up the tibial area, more on the lateral side, just lateral to the tendon, the patellar tendon, in through there. So we have that. It's nice. It's working pretty well for us, and we start to feel this now come over, right? Come over, get clear and come over, right? Get clear and come over, clear. Down and through here. Right around the malleolus that would disappear in through here. Right, tendon coming down and over. That's feeling pretty nice now and through. Right in through there. All right. Now on the other side, we're going to get the gastrocnemius, maybe a little of the soleus because we're looking underneath it. This is going to emerge down in through here and over, right? So we come up, this will flatten a little bit. It's medial, so that means it's going to be longer looking, even though we're in this perspective, it still will take on that range. You get meaty here, we'll get an axis point of width roughly in through here, come across and over, and of course that will attach back over up into those finger areas, and if it's the soleus to around over here to the fibia, and then transport itself this way. And then over here, it feels pretty good already with the gastrocnemius. This will get a little bit flatter and come on up. Underneath now, the biceps femoris. The biceps femoris will come and be over the top of the gastrocnemius. Make sure you know that. That's going to be important to see that. All right, so our next muscle is the extensor digitorum longus. Okay, now it gets a little bit more lateral now. Okay, we're going to see it roughly in through here, a little shorter as it attaches up, and gets more pronounced now in this particular view. It's going to come down in through here. Okay. It's roughly still in the tibial area, getting a little bit more lateral, coming down, getting buried. We'd still see it from this point of view, but the tibialis anterior is definitely stronger stronger here, but coming up underneath, getting more of a view here, right? Now, remember that extensor, right? So it's the extensor side, the front side, digitorum longus, digitorum, right? So it's going to go to all four of those. It's going to come over here, right, to here, one, right? I don't have the phalanges, that's okay, I don't want them. Two, right, in through here, three, and four to the second toe, and it does not go to our largest big toe. Okay, remember? You remember that. Remember that, that's important. So the extensor digitorum longus. Extensor digitorum longus. Get the right pencil that I need here. So we're merging underneath here. Let me put a little dark line and then a shadow line to see that. So you can see all this emerge through there and underneath. Okay. This will kind of flatten and bulge, oxymoron a little bit. Okay. Right in through here and around and over. Bulkier here for the tibialis anterior. Right in through here and around. Bulk and head out. These are all kind of touch each other. They're jammed in there. And then lastly, mercifully, right, we have the longus now and the brevis. So coming up in through here, attaching up tendinous material in through here. Okay, a little bit shorter in that area. Now remember, now we have the longus in through here, very much more lateral. So the longus, a little bit shorter now, not here, not higher, so a little bit shorter now, or attaching now on the fibia. So here's the fibia here, right? There's fibia in through here. Make sure we have that. There's our fibia. Roughly right in through here's our longus. Right in through here. Coming down. Right through here. And we know this is going to the first ride. It's going to take a ride too as well. It's going to be going over. Coming down, the brevis would be underneath, about right in through here. I'll make a little distinction with the two of them. They'll roughly be on top of each other. We'll get a little more fullness in here because of that. Roughly right in through here. This is the soleus now. You might get the longus in the brevis a little bit stronger look. Soleus and gastrocnemius going back to the Achilles, we'd get maybe just a little bit of that. We'd get this pull, probably some gathering of material, and get this kind of view here around, some fat gathering, or padding, excuse me, not fat. You need that padding underneath there and over, and this would gather here. The foot through here, and then you get this very strong delineation of the fifth metatarsal there. That's going to be strong to the end of the pinky. Downward trending right through here, roughly like so. Let's go back to our brevis and longus. So remember now the brevis coming down here on the fibia, fibialis, brevis. Fibia, turning, curling underneath now, and we're going to go to that fifth, right in through, right in through to the top of that fifth. So let me get this clear here, right in through there we go. So that cleans up there. And the longus now is going to come underneath and get more tendinous here, okay? Going to come underneath here, so I'll do it in dark, underneath, pull over, probably underneath all this digitorum longus tendinous material. That's going to come all the way now over and get to the top of that first metatarsal area. A little bit shorter, actually right in through here. That's the knuckle of the big toe, right in through here, right in through there. There we go. So that's going to pull up and around. and over and out to there. So we have that working for us. And so now we're looking pretty good. I think we've got now just about all the material we need to finish our leg study. We'll just get a little bit cleaner here with it. Finish that out. So there's a lot to work with, but if you take it in waves, in sections, you can really do yourself a whole lot of wonderful understanding in through here. So maybe we'll take a little bit of the darker charcoal. Come through here. Okay. Through here a little bit. Underneath. Get a little bit of contrast going. Almost said a little bit of love, that would be weird. Love for the anatomy, I suppose. Okay. There we go, and then we can do a little bit of the top here as well. Just to clean things up and get it clear. I don't want to go too crazy and expressive, especially with just old anatomy, but it is important to get this clean. So we have a little bit of that soleus now, and the gastrocnemius showing on the medial side, right through there. There we go. Got it cleaned up. I think that's getting closer to what we want, and then we can turn this, maybe show that this muscle is pulling, really pulling and turning this way, right? Really coming back that way. Really important to look at. All right, so I think we've got a good active diagram. I think I'll just make it just one for this video, because I think you get the idea for the rest, and you can go on to your own and really start to take charge with your study. All right, good luck with it, and keep on drawing. I'll see you guys next time. Take care. Bye-bye.